Hey everyone, welcome to my channel. In this video, we talk about AI in healthcare and transforming the medical industry. And don't forget to subscribe and like and turn on the notification button. Artificial intelligence, AI, is a powerful and disruptive area of computer science, with the potential to fundamentally transform the practice of medicine and the delivery of healthcare. We outline recent breakthroughs in the application of AI in healthcare, describe a roadmap to building effective, reliable, and safe AI systems, and discuss the possible future direction of AI-augmented healthcare systems. Healthcare systems around the world face significant challenges in achieving the quadruple aim for healthcare: improve population health, improve the patient's experience of care, enhance caregiver experience, and reduce the rising cost of care. Aging populations, growing burden of chronic diseases, and rising costs of healthcare globally are challenging governments, payers, regulators, and providers to innovate and transform models of healthcare delivery. Moreover, against a backdrop now catalyzed by the global pandemic, healthcare systems find themselves challenged to perform, deliver effective high-quality care, and transform care at scale by leveraging real-world data-driven insights directly into patient care. The pandemic has also highlighted the shortages in healthcare workforce and inequities in the access to care, previously articulated by the King's Fund and the World Health Organization. The application of technology and artificial intelligence (AI) in healthcare has the potential to address some of these supply and demand challenges. The increasing availability of multimodal data, genomics, economic, demographic, clinical, and phenotypic, coupled with technology innovations in mobile Internet of Things (IoT), computing power, and data security herald a moment of convergence between healthcare and technology to fundamentally transform models of healthcare delivery through AI-augmented healthcare systems. In particular, cloud computing is enabling the transition of effective and safe AI systems into mainstream healthcare delivery. Cloud computing is providing the computing capacity for the analysis of considerably large amounts of data at higher speeds and lower costs compared with historic on-premises infrastructure of healthcare organizations. Indeed, we observe that many technology providers are increasingly seeking to partner with healthcare organizations to drive AI-driven medical innovation enabled by cloud computing and technology-related transformation. AI in medical field, great advances have been made in using artificially intelligent systems in case of patient diagnosis. For example, in the field of visually oriented specialties, such as dermatology, clinical imaging data has been used by Estiva et al. And Heckler et al. To develop classification models to aid physicians in the diagnosis of skin cancer, skin lesions, and psoriasis. In particular, Estiva et al. Trained a deep convolutional neural network (DCNN) model using 129,450 images to classify images into one of two categories, also known as binary classification problem in machine learning, as either keratinocyte carcinoma or seborrheic keratosis, and malignant melanoma or benign nevus. They further established that the DCN achieved performance at par to that of 21 board-certified dermatologists. The research demonstrated that AI systems were capable of classifying skin cancers with a level of competence comparable to dermatologists and required only a fraction of the time to train the model in comparison to physicians who spend years in medical school and also relied on experience they developed through patient diagnosis over decades. Much work has also been done in the realm of AI and patient prognosis. For instance, researchers at Google 7 developed and trained a DCNN using 175 retinal fundus images to classify images as diabetic retinopathy and macular edema for adults with diabetes. There are several advantages of the existence of such an artificially intelligent model, such as automated grading of diabetic retinopathy, leading to increased efficiency in diagnosing many patients in shorter time, serving as a second opinion ophthalmologists. Detection of diabetic retinopathy in early stages due to capability of the model to study images at the granular level, something impossible for a human ophthalmologist to do. Vast coverage of screening programs, reducing barriers to access. Huge strides have been made in application of AI systems to drug discovery and providing personalized treatment options. Companies such as Verge Genomics focus on the application of machine learning algorithms to analyze human genomic data and identify drugs to combat neurological diseases, such as Parkinson's, Alzheimer's, and amyotrophic lateral sclerosis, ALS, in a cost-effective way. Present-day use of AI. The most recent application of AI in global healthcare is the prediction of emerging hotspots using contact tracing and flight traveler data to fight off the novel coronavirus COVID-19 pandemic. Contact tracing is a disease control measure used by government authorities to limit spread of a disease. Contact tracing works by contacting and informing individuals that have been exposed to a person who has contracted the disease and instructing them to quarantine to prevent further spread of the disease. As reported by Apple Newsroom, tech giants like Google and Apple have joined forces to create a contact tracing platform that will use artificial intelligence systems through the use of application programming interfaces, commonly referred to as APIs on smartphones. The platform will enable users who choose to enroll to report their lab results. Location services will then allow the platform to contact people who may have been in the vicinity of the infected person. Canadian company Blue Dot creates outbreak risk software that mitigates exposure to infectious diseases. Blue Dot published the first scientific paper on COVID-19 that accurately predicted the global spread of the virus. The company uses techniques such as natural language processing (NLP), machine learning (ML), along with automated infectious disease surveillance by analyzing approximately 100,000 articles from over 65 countries every day, travel itinerary information and flight paths, an area's climate, temperature, and even local livestock to help predict future outbreaks. Here are some key areas where AI is making a significant impact in healthcare. 1. Diagnostic imaging, radiology. AI algorithms can analyze medical images such as X-rays, CT scans, and MRIs to assist radiologists in detecting abnormalities and making more accurate diagnoses. This helps in early detection of diseases like cancer. 2. Predictive analytics. AI algorithms analyze patient data to identify patterns and trends, enabling healthcare professionals to predict potential health issues and intervene earlier. This can improve patient outcomes and reduce the burden on healthcare systems. 3. Drug discovery and development. AI accelerates the drug discovery process by analyzing vast datasets to identify potential drug candidates, predict their efficacy, and optimize their chemical structures. This reduces the time and cost involved in bringing new drugs to market. 4. Personalized medicine. AI analyzes patient data, including genetic information, to tailor treatment plans to individual patients. This enables more effective and targeted therapies, minimizing adverse reactions and improving overall treatment success rates. 5. Virtual health assistants. AI-powered virtual assistants and chatbots are being used for patient engagement, providing information, answering queries, and even assisting in medication adherence. This helps patients manage their health more effectively. 6. Administrative efficiency. AI streamlines administrative tasks such as billing, scheduling, and record-keeping, reducing the administrative burden on healthcare professionals. This, in turn, allows them to focus more on patient care. 7. Telemedicine and remote monitoring. AI facilitates remote patient monitoring through wearable devices and sensors. This helps healthcare providers track patients' vital signs and manage chronic conditions, leading to more proactive and personalized care. 8. Natural language processing (NLP). NLP allows AI systems to analyze and understand human language. This is beneficial for tasks such as extracting valuable information from medical records, transcribing voice notes, and facilitating better communication between healthcare professionals. 9. Robotics in surgery. AI-powered robotic systems assist surgeons in performing complex surgeries with precision and control. This can lead to shorter recovery times and reduced risk of complications. 10. Cybersecurity in healthcare. AI is used to enhance the cybersecurity of healthcare systems, protecting sensitive patient data from cyber threats and ensuring the integrity of medical records. While AI offers numerous advantages in healthcare, it is essential to address ethical concerns, data privacy issues, and ensure that these technologies are implemented responsibly to maximize their benefits while minimizing risks. Ongoing collaboration between healthcare professionals, researchers, and technology developers is crucial to harness the full potential of AI in transforming the medical industry. The future of AI in medical sciences. Despite the above limitations, AI looks well-positioned to revolutionize the healthcare industry. AI systems can help free up the time for busy doctors by transcribing notes, entering and organizing patient data into portals such as EPIC, and diagnosing patients, potentially serving as a means for providing a second opinion for physicians. Artificially intelligent systems can also help patients with follow-up care and availability of prescription drug alternatives. AI also has the capability of remotely diagnosing patients, thus extending medical services to remote areas beyond the major urban centers of the world. The future of AI in healthcare is bright and promising, and yet much remains to be done. The application of artificially intelligent systems in healthcare for use by the general public is relatively unexplored. Only recently the FDA, U.S. Food and Drug Administration, approved a live-course CardioVent in 2017 and Apple's smartwatch Series 4 in 2018 to detect atrial fibrillation. The use of a smartwatch is a first step toward empowering people to collect personal health data and enable rapid interventions from the patient's medical support teams. AI has the potential to help fix many of healthcare's biggest problems, but we are still far from making this a reality. One big problem and barrier for making this a reality is data. We can invent all the promising technologies and machine learning algorithms, but without sufficient and well-represented data, we cannot realize the full potential of AI in healthcare. That's it for today's video. If you enjoyed this content, don't forget to like and subscribe to our channel for more fascinating insights. Be sure to hit the bell icon to stay updated with our latest videos. We also encourage you to leave a comment below, sharing your thoughts and suggestions for future topics. Thanks for watching.